we had a discussion on, we understood that the size of the organ increases. We also had a discussion that the vascularity of the organs increases. We also had a discussion that the secretions are going to increase. All this is going to be occurring in all the reproductive organs. If you can see in the cervical part also, in the last lecture we had a discussion कि वो internal os, दो internal osses जो रहता है, physiological internal os and the histological internal os, उसके बीच में जो 0.5 centimeters का gap है, that becomes 5 centimeters to become a lower segment. Because it is stretched 10 times, it is very thin and it can be very well utilized for doing the surgeries, these lower segment cesarean sections. Now, when the pregnancy is going to grow in the uterine cavity, as we understood that pregnancy is a progesterone dominated system, and because of the progesterone, this is something which is going to get formed. This is the mucus plug. If you can see, the vascularity has increased, that we already have been aware about. This is what becomes the columnar epithelium. ये जो है यहाँ पे, this is what green color जो है वो squamous epithelium है. ये green color का जो है वो squamous epithelium है. And this columnar epithelium, this is the junction called as squamo-columnar junction. Squamo-columnar junction. अभी ये columnar epithelium जो है, this columnar epithelium is red in color, whereas squamous epithelium is pink in color. So during pregnancy, what exactly is going to happen? This red color का epithelium is going to extend beyond the regular location. यहाँ तक ही normally रहता है. If you can see, it has extended beyond it. This is called as extension of the columnar epithelium, which is red in color. And because of that, when you examine the cervix during pregnancy, normally you see the red color का epithelium is coming out. It is commonly called as cervical erosion. If it is not pregnancy, it is pathological. If it is pregnancy, it is physiological. That is the reason in the beginning part only I said it is important to understand the physiological concepts behind pregnancy, so that we can understand what exactly is a disease, what exactly is not a disease. तो रेड कलर का epithelium जो है थोड़ा सा बाहर आ जाता है, and that is called as an extension of the columnar epithelium, and that looks like an erosion. क्योंकि ये नॉर्मल इपिथेलियम हो जाने का जो है वो पिंक है. अभी अपने को क्या दिख रहा है? रेड कलर का पार्ट ये दिख रहा है बाहर, एंड दैट इज व्हाट इज extension of the columnar epithelium, which is erosion, looks like an erosion. Now what is the importance of this mucus plug? This is a progesterone dominated. ये mucus plug जो रहता है, because inside is a pregnancy. ये pregnancy के let's say membranes है. These are the membranes of the pregnancy. So this mucus plug prevents direct entry of an organism into the uterus. This is a thick mucus plug dominated by progesterone, and this prevents the infection going into the uterus, and that is what is the importance of this. Sometimes the squamous cells also becomes hyperactive, and mucosal changes may stimulate